This conference will now be recorded.
Okay, today's class is on spotters, practical records. Everyone had record? Hello? Students, all of you have
No,
records?
sir, we don't have.
No one. Started and what? Okay, today's class. The right spotters, right? In these spotters, we have chemical structures, drug injections, drugs, tablets, instruments, crude drugs, mechanism of action, scientist, ADR. There are 8 types of spotters are there for you people in this pharmacology. Today I'll deal the chemical structures and I'll see how many are finished. Okay, am I audible? Am I audible?
Yes, sir.
Write about chemical structures. First spotter is chemical structure. All of you write down, take a note and copy these notes when you came to the college. Copy these notes to the to your records. Okay. First you write in your running notes. I'll deal with these spotters and Vasu madam and Uday sir will deal with that prescription writing and graphs, other practical part. Okay, today's first of all you write spotters. On that spotters you need to write chemical structures. First one is chemical structure. First one is chemical, right? Chemical structures. Okay. In this chemical structure, they will ask and they will put that this one chart on your table, and they will ask 2 questions. Identify the chemical structure of the drug and mention the important adverse effects. Okay, identify the chemical structure of drug and mention the important adverse effects. You need to identify the, when you see on the this chemical structure, they don't put that atropine. They will only put that chemical structure. They don't the atropine will be covered. Okay, they will then you need to identify the structure and you need to write the 2 adverse effects of that chemical structure. Okay, but to identify that chemical structure, we are giving that chemical structure detail. But no need to write that chemical structure detail on your spotters exam. But you need to write, first you need to, when you see that chemical structure, you need to identify that what is that atropine or dapsone, what is isoniazid or dopamine, you need to identify that, you need to write that it is atropine. Then you need to write adverse effects of that chemical structure. No need to write this chemical structure details, don't need to write. But to identify, for you people to identify that chemical structure, we are giving that details. Okay, first one is write atropine. Are you following, students? Students, are you following?
Yes, sir.
Okay, right. First one, first chemical structure is atropine. Atropine. Then write matter. You need to write this matter on your records. Okay. Ester of tropic acid and tropicamine. Ester of tropic acid and tropicamine. Free OH group to acyl portion of the ester. Free OH group to acyl portion of the ester. This atropine is a quaternary ammonium compound. Okay, quaternary ammonium compound. Then this is about the chemical structure of atropine. Ester of tropic acid and tropicamine. Free OH group to the acyl portion of the ester. It is a quaternary ammonium compound. No need to write this matter on your examination. For you to identify that one, this atropine is that matter is there. Now, important matter. This atropine adverse effects, side effects, right? Side effects of atropine. What are the side effects of atropine? Dryness of mouth, blurring of vision, photophobia, constipation, urinary retention, decreased sweating, precipitation of glaucoma. Dryness of mouth, blurring of vision, photophobia, constipation, urinary retention, decreased sweating, precipitation of glaucoma. These are all the adverse effects of atropine. In your exam, you need to write 2 or 3 points of adverse effects of atropine. Okay. Shall I move? Finished writing? Copied? Shall I move to next one? Atropine. Adverse effects are dryness of mouth, blurring of vision, photophobia, constipation, urinary retention, decreased sweating, precipitation of glaucoma. This matter you need to write in record. First, you need to, all of you copy this matter in your notebook, and when you came to college, you need to write that one in your records. Okay. Second one is chlorpromazine. A phenothiazine. It is a phenothiazine. Tricyclic structure. It is a tricyclic structure. Benzene rings are linked by sulfur and nitrogen. Benzene rings are linked by sulfur and nitrogen. Aliphatic side chain. Substitution of electron withdrawing group of at position 2 increases the antipsychotic efficacy. This is about the chlorpromazine tricyclic structure. Benzene rings are linked by sulfur and nitrogen. Aliphatic side chain. Substitution of electron withdrawing group at position increases the antipsychotic efficacy. It is the structure. It is a tricyclic structure. Chlorpromazine is a tricyclic structure. Coming to side effects of chlorpromazine. All of you copy this one. Write this matter. Chlorpromazine side effects are extrapyramidal symptoms like Parkinsonism, dystonias, akathisia, neuroleptic malignant syndrome, perioral tremors. Extrapyramidal symptoms like Parkinsonism, dystonias, akathisias, neuroleptic malignant syndrome, perioral tremors. This is about the chlorpromazine, antipsychotic drug. This is chlorpromazine. Side effects are all of you writing. Students. Extrapyramidal symptoms like Parkinsonism, dystonias, akathisia, neuroleptic malignant syndrome, perioral tremors are the side effects of chlorpromazine. It is a tricyclic structure. Okay. This is about the chlorpromazine. Then dopamine. Sear. Hello. Sear is there?
Hello.
Malleswaram.
Hello, sir.
All of your colleagues are writing this one. They are copying.
Yes, sir.
They need to copy
Yes, sir.
this
Yes, sir.
all this matter. ఈ మ్యాటర్ అంతా కాపీ
Okay, sir.
చేసుకుని ఇదంతా రైటింగ్ అయిన తర్వాత అది మళ్ళా రికార్డ్ లో రాయాలి. మీ ఫ్రెండ్స్ అందరికి చెప్పు కంపల్సరీ మీ క్లాస్
Okay, okay.
ఇంటిమేట్ చేయి. తర్వాత వాటర్స్ అన్ని ఇప్పుడు ఇదివరకు యాక్చువల్ గా మీ క్లాసెస్ థియరీ క్లాసెస్ ఎలా జరిగినాయి, ప్రాక్టికల్ క్లాసెస్ కూడా అలాగే జరుగుతాయి.
Okay, sir.
Okay,
Okay.
coming to dopamine. Third one is dopamine. Dopamine is a catechol moiety linked to the ethylamine. Dopamine catechol moiety linked to ethylamine. Then side effects of dopamine are nausea, vomiting, tachycardia, ectopic beats, cardiac arrhythmias. Nausea, vomiting, tachycardia, ectopic beats, cardiac arrhythmias. These are the side effects of dopamine. It is a catechol moiety linked to the ethylamine. This is the structure of the dopamine. Dopamine side effects are nausea, vomiting, tachycardia, ectopic beats, cardiac arrhythmias. Then coming to the digoxin. Digoxin. It is a steroid nucleus linked to a lactone ring. Digoxin chemical structure is it is a steroid nucleus linked to a lactone ring. That was the chemical structure of the digoxin. Okay. Then coming to the side effects of digoxin is bradycardia, partial or complete heart block, atrial or ventricular extrasystoles, coupled beats, ventricular fibrillation. These are the side effects of digoxin. Bradycardia, partial or complete heart block, atrial or ventricular extrasystoles, coupled beats, ventricular fibrillation. All of you writing this one? Students, are you copying? What? No one is answering. Students?
Yes, sir.
All of you copy.
Why, sir?
Write these notes. Digoxin. This is steroid nucleus linked to a lactone ring. Side effects are bradycardia, partial or complete heart block, atrial or ventricular extrasystoles, coupled beats, ventricular fibrillation. Are the side effects of digoxin. Then another structure is chemical structure is isoniazid. Isoniazid is which kind of drug? Isoniazid. Your chemotherapy is over now. Isoniazid is which kind of drug? What type of drug it is? Isoniazid, very important drug. No one is studied now. Isoniazid. No one is answering. Isoniazid is a what type of drug? Which group of drug it is? Very good. Anti-tubercular drug. You can answer. No need to. Isoniazid is a anti-tubercular drug. Its chemical structure is isonicotinic acid hydrazide. Isonicotinic acid hydrazide. Adverse effects of isoniazid is peripheral neuritis, paresthesia, numbness, mental disturbances, hepatitis. Peripheral neuritis, paresthesia, numbness, mental disturbances, hepatitis. Peripheral neuritis, mental disturbances, hepatitis, numbness. These are the side effects or adverse effects of the isoniazid. Okay. Then morphine. Morphine is which group of drug? Morphine. Morphine. In which system it will come? Morphine. No one is reading. No one is answering.
Opioid.
Opioid analgesics. Very good. Morphine. Morphine chemical structure is 3OH, 6OH, and 17CH3. Morphine chemical structure is 3OH, 6OH, 17CH3. Okay. Coming to the adverse effects of morphine is respiratory depression, constipation. Respiratory depression, constipation are the adverse effects of morphine. Okay, 3OH, 6OH, 17CH3. Adverse effects are respiratory depression, constipation. Then cubocurarin. Cubocurarin is the cyclic benzyl isoquinoline. Cyclic benzyl isoquinoline. Okay, cyclic benzyl isoquinoline is cubocurarin. Side effects of cubocurarin is respiratory paralysis, prolonged apnea, flushing. Respiratory paralysis, prolonged apnea, and flushing are the side effects of cubocurarin. Cubocurarin chemical structure is a cyclic benzyl isoquinoline. Side effects are the respiratory paralysis, prolonged apnea, flushing are the side effects of cubocurarin. Then dapsone. Dapsone, which group of drug is it? Is dapsone? Very important drug. Dapsone. Anyone knows? Antileprotic. Very good. Dapsone. Diamino diphenyl sulfone. 4-diamino diphenyl sulfone. Diamino diphenyl sulfone. 4-diamino diphenyl sulfone is the dapsone. Chemical structure is okay. Coming to the structure, side effects of dapsone are hemolytic anemia, gastric intolerance, methemoglobinemia, headache. Hemolytic anemia, gastric intolerance, methemoglobinemia, headache are the side effects of dapsone. Hemolytic anemia, gastric intolerance, methemoglobinemia, headache are the side effects of dapsone. It is a diamino diphenyl sulfone and 4-diamino diphenyl sulfone. Okay, then that is about the dapsone. Then halothane. Halothane is the 2-bromo 2-chloro 111 trifluoroethane. Halothane is a 2-bromo 2-chloro trifluoroethane. Is the halothane. Side effects of halothane are hepatitis, malignant hyperthermia, hepatitis and malignant hyperthermia. That is about the halothane. Halothane is chemical structure of halothane is 2-bromo 2-chloro 2-bromo, 2-chloro, 111 trifluoroethane. Hepatitis, malignant hyperthermia are the side effects of halothane. Then cortisone. Cortisone 4,5 double bond keto group on a ring A. 11B hydroxyl group at C21 on ring D. Okay, that is about the cortisone chemical structure. Side effects of cortisone are the hypertension, hyperglycemia, Cushingoid features. Hypertension, hyperglycemia, Cushingoid features are the side effects of cortisone. Okay, cortisone chemical structure is 4,5 double bond keto group on ring A. 11 beta hydroxyl group at C21 on ring B. Okay, the side effects of cortisone are the hypertension, hyperglycemia, Cushingoid features are the side effects of cortisone. Okay, okay, this is about the chemical structures. Okay, we have totally 2, 3, 4, 5, 7, 8. We have totally 10 chemical structures are there. Okay, from starting onwards, atropine, then chloroflamazine, dopamine, digoxin, isoniazid, morphine, teiboquirarin, dapsone, halothane, cortisone. These are the total 10 chemical structures. You need to identify the chemical structure. You need to write the adverse effects of that chemical structure. Okay, clear? Okay, this is about the first spotter. Coming to the second spotter, drugs injections. Drugs injections. Okay, you have two types of spotters are there: drugs injections, drugs tablets or capsules. Okay, coming to the drugs injections, right? Second spotter, second group of spotters are drugs injections. Okay, in that one, in this spotter, you need to write. They will put this bottle on your table. You need to write what type of spotter it is by seeing that one. They will ask questions there. Write the important therapeutic uses. Okay, you need to identify that spotter. First, you need to identify that spotter, and second one, you need to write the important therapeutic uses. Therapeutic uses of that spotter. Okay, there are 1, 2, 3, 4, 5, 6, 7. 7 drugs injection spotters are there. 7 drugs tablets or capsules spotters are there. First one, they will put that bottle or any spotter there, that injection there. You need to identify that injection, what injection it is. Okay, they will write this one also, heparin injection also there. That was there. You need to write this one heparin, and you need to write therapeutic important therapeutic uses, important therapeutic uses. Okay, okay, then first one is heparin. What are the therapeutic uses of heparin? Anyone answer? What are the therapeutic uses of heparin? No one knows. For treatment and prophylaxis of, write that one. First you write heparin and write uses for treatment and prophylaxis of anticoagulant. Okay, uh, write the important therapeutic uses for treatment and prophylaxis of deep vein thrombosis, DVT. For treatment and prophylaxis of deep vein thrombosis, DVT. And second therapeutic uses for treatment of unstable angina. For treatment of unstable angina. Second therapeutic uses for treatment of unstable angina. Heparin important therapeutic uses are first uses for treatment and prophylaxis of unstable deep vein thrombosis. Treatment and prophylaxis of deep vein thrombosis, DVT. And for treatment of second uses for treatment of unstable angina. Treatment of unstable angina. These are the two therapeutic uses of heparin. Treatment and prophylaxis of deep vein thrombosis, DVT, for treatment of unstable angina. Write these 2 points. Treatment and prophylaxis of deep vein thrombosis, for treatment of unstable angina. Second uses for treatment of unstable angina. This is about the heparin. Okay, all of you wrote that one. All of you wrote.
Yes, sir.
Then coming to second injection is metronidazole. What are the uses of metronidazole? You can directly answer. What are the uses of metronidazole? For treatment of anaerobic infections. For treatment of, write this one. For treatment of anaerobic infections and gastroenteritis comma amoebiasis for treatment of anaerobic infections metronidazole for treatment of anaerobic infections and gastroenteritis and amoebiasis. These are the important therapeutic uses of metronidazole for treatment of anaerobic infections, gastroenteritis and amoebiasis. That is about the metronidazole. Okay, then gentamicin. What are the uses of gentamicin? Gentamicin uses are for treatment of gram-negative bacterial diseases. For treatment of gentamicin, for treatment of gram-negative bacterial diseases like pneumonia, urinary tract infections. For treatment of gram-negative bacterial diseases like pneumonia, urinary tract infections. Okay, gentamicin, it is used for the treatment of gram-negative bacterial diseases like pneumonia and urinary tract infections. Okay, then diazepam. What is the use of diazepam? Diazepam for treatment of status epilepticus. Yes, is okay. Treatment of status epilepticus, anxiety. For treatment of status epilepticus, anxiety. Diazepam uses are treatment of status epilepticus, anxiety. Okay, diazepam, treatment of status epilepticus, anxiety. Then diclofenac. What are the uses of diclofenac? used as a analgesic, diclofenac, used as analgesic in the treatment of osteoarthritis and rheumatoid arthritis. Used as a analgesic in the treatment of osteoarthritis and rheumatoid arthritis. Diclofenac used as a analgesic in the treatment of osteoarthritis and rheumatoid arthritis. Analgesic in the treatment of osteoarthritis and rheumatoid arthritis. That is they are the uses of diclofenac. Then lignocaine. What is the main use of lignocaine? All of you knows, I think so. Lignocaine. Lignocaine is a local anesthetic. Very good. Rohita Sai 66 is she is well responding. Lignocaine used as a local anesthetic, anti-arrhythmic. Used as a local anesthetic and anti-arrhythmic. Lignocaine, local anesthetic and anti-arrhythmic. This is about the lignocaine, local anesthetic, anti-arrhythmic. All of you write that matter what I am saying. Then you can copy to the record. Then furosemide. Furosemide. What kind of group? What group of drug it is? Diuretic. Very good. Deep 17. Furosemide for treatment of edema. Treatment of edema in congestive heart disease. Furosemide uses for treatment of edema. For treatment of edema in congestive heart disease. Congestive heart disease, hypertension. Furosemide also used in hypertension. Furosemide for treatment of edema in congestive heart disease, hypertension, hypertension. Furosemide, treatment of edema in congestive heart disease and hypertension. Then amoxicillin. This is about the still now injections are that is about the injections. Okay. Then now about the tablets. Okay. Okay. Injections. Once again I am revising injections. Heparin, then metronidazole, gentamicin, diazepam, diclofenac, lignocaine, furosemide. These are all the 7 injections. Then coming to tablets, capsules. Tablets are capsules. Okay, drugs, tablets are capsules. Okay, first one is amoxicillin. Okay, what is the for this tablets are capsules? You need to write. You need to identify that spotter, what type of drug it is, and what are the main important therapeutic uses. You need to write that one. Write the 2 points. You need to identify the drug, what kind of drug it is. Okay, you can read that one. It was there in on that sheet. Okay, and we need to write what are the main therapeutic uses of the drug or capsule. Okay, what are the main therapeutic uses of amoxicillin? Amoxicillin, right? Amoxicillin is a oral penicillin. Amoxicillin is a oral penicillin. Main therapeutic uses are for treatment of upper respiratory tract infections. For treatment of upper respiratory tract infection. broad spectrum penicillin. Okay. For treatment of amoxicillin is a oral penicillin. Write that first point. Second point is main uses are for treatment of upper respiratory tract infections, UTI. Urinary, not UTI, upper respiratory tract infections. Okay. For treatment of upper respiratory tract infections, rheumatic heart disease. Rheumatic heart diseases. Second use of amoxicillin. Amoxicillin uses are upper respiratory tract infections, rheumatic heart disease. Okay, these two uses are the important therapeutic uses of amoxicillin: upper respiratory tract infections and rheumatic heart disease. Then ciprofloxacin. Okay. Ciprofloxacin. Coming to ciprofloxacin, what are the uses of ciprofloxacin? Ciprofloxacin for treatment of urinary tract infections, UTI. Very good. Ciprofloxacin uses are urinary tract infections and dysentery. Dysentery. For treatment, right? Ciprofloxacin, right? For treatment of urinary tract infections, dysentery. Okay, that is about the ciprofloxacin. Then paracetamol. Okay, what is the use of paracetamol? Even common people, they know what are the uses of paracetamol. What are the uses of paracetamol? Paraxia, antipyretic. Right, it is a right antipyretic for treatment of fever, pain, headache. For treatment of fever, pain, headache, paracetamol. Okay, you need to identify that sheet, what type of drug it is. Then you write paracetamol. Then you need to write main therapeutic uses. It is a antipyretic, but it is used for the treatment of fever, pain, headache. Fever, pain, headache. That is about the paracetamol. Then chloroquine. Chloroquine is a what group of drug it is? Chloroquine, malaria, anti-malaria. For treatment of anti-malaria, chloroquine. For treatment of malaria, rheumatoid arthritis, chloroquine, right? Uses for treatment of malaria, rheumatoid arthritis, chloroquine. Then chloroquine for treatment of malaria and rheumatoid arthritis. Then dicyclomine. Dicyclomine What are the uses of dicyclomine? For treatment of irritable bowel disease. Very good, Susmita. For treatment of intestinal colicky pain. Intestinal colicky pain. COLICKY. Colicky pain. Intestinal colicky pain. Dicyclomine for treatment of intestinal colicky pain, dysmenorrhea. That is the use of dicyclomine for treatment of intestinal colicky pain and dysmenorrhea. Then cetirizine. Even common people also know about this cetirizine. Use of cetirizine. What are the uses of cetirizine? Cetirizine. Uses of cetirizine is for allergy and cold. Very good. Anti-allergic. Cetirizine uses are for treatment of antihistamine, for treatment of allergy and cold. Cold. For treatment of allergy, cold. Then propranolol. What are the uses of propranolol? Propranolol. Propranolol. What are the uses of propranolol? Hypertension. Very good. ఇంకా antihypertensive. For treatment of very good antiarrhythmic. For treatment of hypertension, used as a antiarrhythmic, tremors, anxiety. Okay, propranolol uses are for treatment of hypertension, used as a antiarrhythmic, tremors, anxiety. Okay, they are used in tremors also, anxiety, headache, anxiety, hypertension, antiarrhythmic, tremors, anxiety. Okay, these are the uses of propranolol. Okay, this is about the tablets or capsules. Okay, drugs, injection. First drugs are injections, second group of drugs are tablets. Okay, once I will revise these drugs. Amoxicillin, ciprofloxacin, paracetamol, chloroquine, dicyclomine, cetirizine, propranolol. Okay, how many spots? 1 2 3 4 5 6 7. These drugs also, tablets also, 7 spots are there. Any spotter you may have. Okay, that is about the tablets or drugs. Last one today I'll finish that one also, instruments. Then tomorrow onwards, tomorrow we will see 2 drugs. Okay, instruments. Then coming to another spotter. Another spotters are instruments. Write about instruments. In instruments, they will put that they will put one instrument on your table. Then you need to identify what type of instrument it is. Then you need to write. They will ask the question there also. Name the drugs administered through instrument. Name the drugs administered through this instrument. Okay, name the drugs administered through this instrument. Okay, what are the drugs administered through this instrument? You need to write that write that about the drugs names. Okay, for example, insulin syringe. What type of drugs are administered through this instrument? What type of drug? Okay, insulin. What type of drugs are administered through this instrument? I am asking that question. Through insulin syringe, what type of drugs are administered? Again, chart I have not seen. What type of drugs are administered? Insulin syringe. Insulin is administered through this insulin syringe. Okay. Okay. Again, I am repeating. In these instruments, they will put one instrument like insulin syringe or metrodacin or rotahel or anything. First, you need to identify what instrument that one. Okay. Second one, they will ask question there. name the drugs administered through this instrument. Then you need to write that what are the drugs are administered through this instrument. You need to write that one. Okay, that was the spotter. Okay, another spotter. Now first one is insulin syringe. What are the drugs administered through this instrument? Answer. What are the drugs? Already I told now. For 10 minutes. What are the drugs administered? Very good. Insulin. And another drug is insulin, comma BCG vaccine. Second drug is BCG vaccine. Okay. Insulin, comma BCG vaccine. These two drugs you need to write that one. Insulin syringe, insulin BCG vaccine. Okay. Then second instrument is meter dose inhaler. Meter dose inhaler. What are the drugs administered through this instrument? Meter dose inhaler, MDI. What type of drugs are administered in this meter dose inhaler? Salbutamol. Very good, Susmita. Very good. Very good. Okay. Write that one. Meter dose inhaler. Meter dose inhaler. Drugs administered through this instrument are salbutamol, corticosteroids. In bracket you write budesonide. Salbutamol, comma corticosteroids. In bracket you write budesonide. Okay. Salbutamol, corticosteroids. In bracket you write budesonide. Then another instrument is rotahaler. This is the rotahaler. Okay. In this rotahaler also drugs administered are salbutamol, beclomethasone. Salbutamol and beclomethasone. Rotahaler. This is the rotahaler. Have you seen? If you have any asthmatic patients in your family, they will use this rotahaler, and they will use. Some people are used meter dose inhalers. Okay, rotahalers drug administered are salbutamol and beclomethasone. Okay, salbutamol and beclomethasone. Then IV set. What are the drugs administered? IV set through IV set. What are the drugs administered through IV set? Saline. Okay. Right. Normal saline, ringer lactate, dextrose, normal saline, ringer lactate, dextrose, normal saline, ringer lactate, dextrose, normal saline are the drugs administered through the IV set. Okay. Then spinal needle. Spinal needle. What are the drugs administered? Drugs administered are bupivacaine, lidocaine. Bupivacaine, lidocaine are the drugs administered through spinal needle. Then coming to simple liver. Simple liver are what are the drugs administered are simple liver. You need to write the uses of simple liver. That's all. No drugs are administered. You need to write this. Write the uses of simple liver. This instrument. Okay. To mark the muscle contractions on a kymograph. Simple liver, it is used to mark the muscle contractions. Muscle contraction on a kymograph. Okay. When graphs are explained, they will explain this about simple liver, kymograph. To mark the write this point, to mark the muscle contractions on a kymograph. That is the use of simple liver. Okay. Then last one, oxygen bend tube. Oxygen bend tube. This is the oxygen bend tube. Okay. To supply oxygen to the isolated muscle in the oxygen bath. Oxygen tube, oxygen bend tube. What is the use of oxygen bend tube? Is to supply oxygen to the isolated muscle tissue in the organ bath. To supply oxygen to the isolated muscle tissue in the organ bath. Okay, that is about the oxygen band tube. This is about the instruments. Okay. Okay. Then once I will revise. These are the instruments: insulin syringe, metadose inhaler, rotahaler, IV set, spinal needle, simple lever, and oxygen band tube. Okay, this is about the instruments and drugs administered. You need to write that, identify that instrument, and you need to write that drugs administered through that instrument. Then last two instruments are there: simple lever and this oxygen band tube. You need to write what are the uses of oxygen band tube, what are the uses of simple lever. Okay, that's all. Okay, with this one I conclude. Okay, now in these quarters. Okay, today we finished the 4 quarters. Chemical structures are finished, drugs injections are finished, drugs tablets are finished, instruments are finished. Tomorrow I'll see another 4 quarters will be finished. Okay.
Yes, sir.
Okay. Bye. See you tomorrow. 11:30. ఏంటి క్లాస్ అయిపోయింది వచ్చినట్టు ఈ పెన్ డ్రైవ్ లో కాపీ చేయమా రేపు మీరే ఉంటారా సెలవు పెడతారు